Well, by most accounts, history was made when the Supreme Court ruled 5-4 the Patient Protection and Affordable Care Act, commonly referred to as Obamacare, is constitutional. But despite the ruling, there's no indication the debate is even close to over. With Americans evenly split over health care reform, it's an issue that politicians on both sides of the aisle will use as a political club to beat their opponent over the head with. Unfortunately, what gets lost in the election year posturing is, as a country, we still spend almost twice as much on health care as other developed nations, while too many Americans, about 1 in 5, lack health insurance. Today, we're going to look at those issues and visit with an Oklahoman that has some common sense solutions on how to solve them. But before we do that, a little background on how we got here.
With the Supreme Court ruling that the Affordable Care Act is constitutional, steps are rapidly being taken to turn a controversial law into reality. And while the main objective of this new law is for everyone to have health insurance, the question that everyone wants to know is, how does this affect me?
The highest court in the land has now spoken. We will continue to implement this law, and we'll work together to improve on it where we can.
While the debate over the Affordable Health Care Act may go on for a while, many of the provisions in the Act are already underway, while others are set to be rolled out in stages. Already in place, insurers are required to cover young adult children under their parents' policies until the age of 26. Those with pre-existing medical conditions also have a little less to worry about, as some states' public insurance plans are gearing up to give people seamless health care coverage. Insurance companies have also been told no more lifetime limits on benefits, meaning that people with long-term or expensive health problems will no longer have to live in fear of caps being placed on benefits over their lifetime. Rebates are also being distributed to help seniors covered by Medicare to help with extra out-of-pocket expenses, often referred to as the donut hole, where Medicare no longer covers seniors' full medicine costs. And effective January 1, 2014, insurance companies will not be able to turn away, drop, or increase prices due to current or pre-existing health conditions. For the millions whose employers do not provide insurance, there will be federal subsidies to help them afford their own insurance. At the same time, large companies will be required to provide health insurance to their employees. The act will also allow more people to receive Medicaid, and if they do not qualify for Medicaid, subsidies are available to help with costs. And with such dramatic changes taking place in our healthcare system, there will undoubtedly be adjustments as the law is put into place.
When we return, I sit down with the former CEO of Integris Health to talk about what he believes is political malpractice when it comes to healthcare reform.